Hi guys, welcome back to my YouTube channel. On today's video, I'm going to be teaching you guys how I do my head to toe assessment, because I've noticed sometimes when you get the rubric for your head to toe assessment, it's like it's all over the place. Like, how do I cluster my care into one beat? I don't want to ask my patient to stand up, let me, listen to your lungs from the back, and then I'm going to say, okay, sit down, let me look at your abdomen. Like, how do I actually follow a certain pattern so that I could do everything at once without stressing the patient? And that's what we're here to talk about today. So first, when you get into the room, of course, you wash your hands, you introduce yourself, you close the curtains to give your patient some privacy. From walking in, you're already doing your assessment. You're looking at how your patient looks, how are they sitting, what is like the general appearance of your patient. I want to ask the patient questions. Have you had something to eat? How's your day going? Just questions to kind of assess their mental status. And you want to check to see if your patient is oriented ×3 or ×4. You could ask what's today's date, which is to check if they are oriented to time, where are they, if they're oriented to place. You could ask them what brought them here, if they're oriented to events, and then you could ask them what's your name. Of course, you do have to ask them what is your name and date of birth, just to make sure you have the right patient. So when they answer questions like that, it shows you that they're also oriented to person, and we need those four. So you've confirmed you have the right patient, you've confirmed you're in the right room. Now you explain that you need to do their head to toe assessment. You tell them why you need to do the head to toe assessment. Now we get into doing the head to toe assessment. You want to start from the head. So you wear your gloves and you're checking your patient's scalp. You're checking to see if they have any lesions. You're checking to see the distribution of their hair, just checking to see if anything is out of place. Once you're done doing that, you want to move on to the eyes. Okay, you need your pen lights. I have my pen lights here. So to check to see if they are reactive to light, you would basically put the light into their eyes. You want to see that the eyes constrict when light is shined on the eye. Okay, no, that's too much, it's too bright. So yeah, that's what you're trying to check. Then you want to check for accommodation as well. You put your pen light and then ask your patient to follow, guys. Anyways, you ask them, you want to see how like they basically accommodate this. Once that is done, I move on. I check the ears. See, it's kind of on the same position, so it's not hard to forget. You check to see if there is like any drainage. You pull to basically check everything. Ask them to cover one ear. Once they do that, you whisper maybe about 2 syllables. For example, I could say baseball, and then you ask them to like repeat what you said. What did I say? Baseball. Okay, now you ask them to cover this here and then say the same thing, maybe different ones this time, so they don't know what to expect. Maybe football, but whisper it and then ask them to repeat what you said. So after you check the ear, then you could move on to the nose. First, check to make sure it's midline like mine. Then you could also check like inside. Ask the patient to occlude one nose, take a breath to see if this is functional. Do the same thing here. Then we could move on to the mouth, right? Sometimes when you ask them to open their mouth, you might need a tongue depressor. It's like a small stick where you used to kind of, depress the tongue so you could see what's going on at the back of the mouth. You could ask them to say ah, just to see the rising and falling of the uvula behind. You check their teeth, check to see if there's any drainage, injury, or anything that shouldn't be there. Basically, we're checking. While still on the face, we want to check cranial nerve 7. You want to ask them, this is the facial nerve, ask them to puff their cheek, like ask them to frown, ask them to smile, ask them to raise their eyebrow. Then you could also ask them to push back against your hand, just to kind of see their strength. Then I like to move on and ask them to shrug against my hand, like I'm putting pressure and asking them to shrug, basically just, checking their strength. Then you want to check to see if there's any crepitus. You want to feel their pulse, their carotid pulse. Please don't do this simultaneously. You have to do it one at a time, right? Because you don't want to occlude and stop blood flow. So you do that, you check the skin. At the same time, you're looking at the skin to see how your patient's skin look. And now we're going to move to the chest and the lungs. We still have this patient in one position. We haven't asked the patient to do anything stressful yet, right? Cool. We want to listen to the heart at the apex. So that's going to be your mid-clavicular line. You want to count. When you get to your 5th intercostal space, that's where you listen to the heart, okay? Listen for a minute. Then we want to listen to the lungs. I have my stethoscope here. I'm just going to show you how we listen. One thing you need to know when it comes to putting on a stethoscope, because I feel like I struggled with this when I newly started. If you see how my stethoscope looks, you see it's pointing this way, right? I don't know if you guys could see. So you basically, the position your nose points towards, that's what you put in. So it has to be pointing to the front. So that's what kind of made it easy for me. So for your lung sounds, you listen, you ask them to take a breath, then you listen. You do the same thing here, then you go here, then you go here, here, and here. Please notice I didn't do this and this and this and this. No, there is a certain pattern you have to go. Here, here, here. It's like a ladder type of thing. I'm gonna draw it on the screen for you to see. Is what you're supposed to do. You could do 4 to 6 in front, and at the back you could do 6 to 8. So at this point you could ask your patient, oh, could you sit up for me? And then you do the same thing at the back. Now we move on to the abdomen. For the abdomen, it's a little different because for others there's something called IPA, like IPPA, which stands for inspect, palpate, percuss, and auscultate. So usually that is like the rhythm we follow when it comes to assessments, because I want to first, inspect my patient before I touch them and before I now listen, right? But for the abdomen, it's different because we want to listen before we start poking. If you poke the abdomen too much, you could either make it, hyperactive, you'd hear more ball sounds than you should. And we do not want anything that is going to mess with our actual assessments. So for the abdomen, you want to inspect first. We are looking at the skin still, inspecting everything. Then we want to listen to the 4 quadrants of the abdomen, okay? You want to check still on the upper body. You want to check the radial pulse. You could do this simultaneously. Now you could ask your patient to push back against your hand just to check their strength. Then you could check the capillary refill. You press down. When you press down, you're kind of occluded. It's going to be white. So once you let go, you want to see blood flowing back there in about 3 seconds. You could also ask the patient to squeeze your hand just to check their strength while we're still on the upper extremity. Now we move on to the lower extremity. We can check the dorsalis pedis. I'm going to put a picture here, and the posterior tibial pulse. And once we are done checking this, you could also check their leg strength, ask them to push back against your hand. Also check the capillary refill for this patient. So once you're done with the legs, you've checked the lower extremity, you've checked the strength, then you could check their neuro. So we've done all this without really asking our patients to stand up. They've been in bed, comfortable. Now you could ask them to stand up, right? We want to check their gait. You could ask them to walk to and fro, back and forth, just to see if they have any shuffling, to just kind of assess how they do with that, right? Now we could do the Romberg test. We want them to have a negative Romberg test. So basically, you ask your patient to stand up, put your hands outward to guard your patient. Ask your patient to stand in between with their eyes closed. So you want to see if your patient has any swaying. If they're able to stand with their feet together, arms at the side, eyes closed for about 30 seconds without being unsteady, they have a negative Romberg test, which is what we want. But if reverse is the case, they have a positive Romberg test, which needs follow-up. Guys, to do your head to toe assessment, you need to have an idea of the cranial nerves. I'm going to be making a video teaching you how I remember the cranial nerves, like the 12 cranial nerves. That brings us to the end of this video. Thanks for watching. Kindly subscribe to my channel, give me a thumbs up, comment, share this with your friends, and don't forget to continue being a blessing in scrubs. I'll see you in my next video. Bye.